Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose, slowly, then out through the mouth. One more time, in through the nose, and out through the mouth. And one last one. Now slowly open your eyes, and let's begin today's video. In today's video, we're going to be talking about the human ear. But before we dive into the different chapters breaking down and explaining the ear, let's first define the ear. The ear is a complex part of an even more complex sensory system. It is situated bilaterally on the human skull at the same level as the nose. The main functions of the ear are, of course, hearing as well as constantly maintaining balance. Now that we have defined the ear, let's dive into the ear's anatomy. As you can see on the picture being displayed on the screen, there are three general parts of the ear: the inner ear, the middle ear, and the outer ear. I'm going to name and explain each part of the ear in these general parts. The helix is the outer posterior superior rim of the ear and curves slightly inward towards the external acoustic meatus, giving the ear its concave geometry. The scava. The scava is the groove between the helix and the antihelix. The antihelix. The antihelix is the raised, thick ridge which runs upwards parallel with the helix in the center of the ear. It bends forward and divides into two legs. The lower leg, called the crus inferior, is slender and protruding, and the upper leg, called the crus superior, is wider and often flatter. The concha. The concha is the fossa bounded by the tragus, incisura, antitragus, antihelix, inferior crus of the antihelix, and root of the helix, into which opens the external auditory canal. It is usually bisected by the crus helix into the cymba superiorly and cavum inferiorly. The auricular lobule. The auricular lobule or earlobe, simply, is the fleshy flaps of the skin on the lowest part of the outer ears. The lobes may be attached, partially attached, or free from the skin of the face. They can vary in shape and size from one person to the next. Earlobes serve no functional purpose but are frequently used for body adornments such as piercings. The elastic cartilage. The elastic cartilage serves to provide strength and elasticity to organs and body structures such as the outer ear. The middle ear muscles, or MEM for short. The middle ear muscles alter the mechanical properties of the middle ear and thus modulate the way sound vibrations are transmitted to the cochlea. Two muscles are involved in this reflex: the stapedius, which attaches to the neck of the stapes, and the tensor tympani, which attaches to the neck of the malleus. The temporal bone. The temporal bone contributes to the lower lateral walls of the skull. It contains the middle and inner portions of the ear and is crossed by the majority of the cranial nerves. The temporal bones help form the sides and base of the skull, where they protect the temporal lobe of the brain and surround the ear canal. The external auditory canal. The external auditory canal is a passageway that leads from the outside of the head to the tympanic membrane, or eardrum membrane, of each ear. The structure of the external auditory canal is the same in all mammals. The malleus. The malleus is one of three ossicles in the middle ear which transmit sound from the tympanic membrane, or eardrum, to the inner ear. The malleus receives vibrations from the tympanic membrane and transmits this to the incus. The incus. The incus, also known as the anvil, is the middle of three small bones in the middle ear. The incus transmits vibrations from the malleus to the stapes. The vibrations then move to the inner ear. The stapes. The stapes is the smallest bone of the human body, located in the middle ear. Its function is to transmit sound vibrations to the inner ear. We just talked about the malleus, the incus, and the stapes, and all of these three bones are collectively called the auditory ossicles. They are primarily responsible for sound conduction from the tympanic membrane to the middle ear. The semicircular canals. The semicircular canals are three tiny fluid-filled tubes in the inner ear that help you keep your balance. When your head moves around, the liquid inside the semicircular canals slushes around and moves the tiny hairs that line each canal. The cochlea. The cochlea is a fluid-filled, spiral-shaped cavity found in the inner ear that plays a vital role in the sense of hearing and participates in the process of auditory transduction. Sound waves are transduced into the electrical impulses that the brain can interpret as individual sound frequencies. The vestibular nerve. The vestibular nerve innervates the vestibular system of the inner ear, which is responsible for detecting balance. The cochlear nerve. The cochlear nerve, also known as the acoustic nerve, is the sensory nerve that transfers auditory information from the cochlear, which is the auditory area of the inner ear, to the brain. It is one of the many pieces that make up the auditory system, which enables effective hearing. The Eustachian tube. The Eustachian tube is an opening that connects the middle ear with the nasal sinus cavity. This tube helps to balance pressure in the middle ear, which is commonly felt as your ears pop in, drain fluid from the middle ear, protect the ear from both hearing sounds your body causes, and nasal drainage. The tympanic cavity. The tympanic cavity is an air chamber that contains a chain of movable bones which transmits the vibrations of the tympanic membrane across the cavity to the middle ear. The tympanic membrane, also called the eardrum. The tympanic membrane separates the outer ear from the middle ear. When sound waves reach the tympanic membrane, they cause it to vibrate. The vibrations are then transferred to the tiny bones in the middle ear. The middle ear bones then transfer the vibrating signals to the inner ear. As you've already seen in the chapter title, in this chapter we're going to be talking about ear illnesses, common ones to be specific. Otitis media. Otitis media is an infection or inflammation of the middle ear. It often occurs in children and can be caused by bacteria or viruses. Symptoms include ear pain, fever, and irritability. Otitis externa. Otitis externa, also known as swimmer's ear, is an infection of the outer ear canal. It's often caused by bacteria or fungi and can result from water exposure, trauma, or inserting objects into the ear. Symptoms include itching, redness, and discharge. Earwax buildup. Excess earwax can accumulate and block the ear canal, leading to discomfort, hearing loss, or tinnitus, which is ringing in the ears. Sometimes it may require professional removal. Meniere's disease. Meniere's disease is a disorder of the inner ear that can cause vertigo, which is dizziness, hearing loss, tinnitus, and a feeling of fullness in the ear. It's thought to be related to fluid buildup in the inner ear. Eustachian tube dysfunction. The Eustachian tube helps equalize pressure between the middle ear and the atmosphere. Dysfunction can cause a feeling of fullness, discomfort, or hearing problems, often related to colds or allergies. Barotrauma. Barotrauma occurs when there's a significant difference in pressure between the inside of the ear and the outside environment, often due to flying, diving, or sudden altitude changes. It can cause pain and damage to the ear. Perforated eardrum. Perforated eardrum is a tear or hole in the eardrum, often caused by infection, injury, or sudden pressure changes. It can lead to pain, hearing loss, and discharge. Since we've talked about rare illnesses regarding the brain and also the eye in our past videos, we're also going to talk about that for the ears. Cholesteatoma. Cholesteatoma is an abnormal growth of skin cells in the middle ear and or mastoid process, which is the bone behind the ear. It can cause chronic infections and damage to the surrounding structures, including the ear bones. Symptoms might include hearing loss, discharge, and a feeling of fullness in the ear. Auditory neuropathy spectrum disorder, or ANSD for short. ANSD is a condition where sound enters the inner ear normally, but there is a problem with how the auditory nerve sends sound signals to the brain. This can lead to hearing loss that varies from person to person and is not always detectable through standard hearing tests. Superior canal dehiscence syndrome, or SCDS for short. SCDS is a rare condition where there is a thinning or absence of the bone overlying the superior semicircular canal in the inner ear. It can cause symptoms like vertigo, hearing loss, and a feeling of fullness in the ear, often triggered by loud noises or changes in pressure. Vestibular schwannoma, or acoustic neuroma. Acoustic neuroma is a benign tumor that grows on the vestibulocochlear nerve, which affects hearing and balance. Symptoms can include hearing loss, tinnitus, dizziness, and imbalance. Although benign, it can cause significant problems if it grows large enough. And just to be clear, vestibular schwannoma is another name for acoustic neuroma. Labyrinthitis. Labyrinthitis is an inflammation of the inner ear, specifically the labyrinth, which affects both hearing and balance. It can be caused by infections, both viral or bacterial, or other conditions. Symptoms include severe vertigo, hearing loss, and nausea. Bilateral vestibular hypofunction, or BVH for short. BVH is a rare condition where the vestibular system responsible for balance is impaired on both sides. It can lead to persistent dizziness, unsteadiness, and difficulty with balance, especially in low light conditions or when moving quickly. Otosclerosis. Otosclerosis is a condition where abnormal bone growth in the middle ear impairs the ability of the stapes bone to vibrate. It can lead to progressive hearing loss. It typically affects adults and can be treated with a surgery or hearing aids. Treacher-Collins syndrome. Treacher-Collins syndrome is a genetic disorder that can affect the development of the bones and tissues of the face and ears. It may lead to hearing loss, among other physical anomalies. These conditions are rare and often require specialized diagnostic techniques and treatment plans. If someone is experiencing unusual or persistent ear symptoms, seeking a consultation with an otolaryngologist, which is an ear, nose, and throat specialist, or related specialist, is important for proper evaluation and management. We've now reached the end of today's video. And with that, I'd like to thank you for staying this long into the video and watching it. And I also like to thank you for even clicking on this video, because it helps me out a lot. And please like and subscribe, and have a great day.